Question 1. A nurse prepares to administer 4 potassium. What is the safest action before starting? A. Give as a rapid 4 push. B. Mix with an antibiotic. C. Ensure it is diluted and infuse via pump. D. Add directly to the 4 bag at bedside. Answer. C. Ensure it is diluted and infuse via pump. Question 2. A confused patient keeps trying to get out of bed. What should the nurse do first? A. Apply wrist restraints. B. Move the patient closer to the nurse's station. C. Administer a sedative. D. Raise all 4 side rails. Answer. B. Move the patient closer to the nurse's station. Question 3. During medication administration, which action best prevents errors? A. Preparing meds for multiple patients at once. B. Performing 3 checks of the medication label. C. Asking a coworker to verify each medication. D. Administering based on the patient's room number. Answer. B. Performing 3 checks of the medication label. Question 4. A nurse receives a new order for a medication the patient reports an allergy to. What is the best action? A. Administer the medication with caution. B. Confirm with the pharmacist and proceed. C. Withhold the medication and notify the provider. D. Ask the patient to try a small dose. Answer. C. Withhold the medication and notify the provider. Question 5. Which situation requires an incident report? A. A nurse administers a medication 5 minutes late. B. A visitor slips and falls in the hallway. C. A patient complains of nausea after lunch. D. A patient has a mild rash from tape. Answer. B. A visitor slips and falls in the hallway. Question 6. What is the nurse's priority action during a fire race protocol? A. Call the fire department. B. Rescue clients in immediate danger. C. Extinguish the fire immediately. D. Close all windows first. Answer. B. Rescue clients in immediate danger. Question 7. A nurse notices a colleague taking narcotics from the medication cart. What is the most appropriate response? A. Ignore it to avoid conflict. B. Confront the colleague directly. C. Report the observation to the nurse manager. D. Share the concern with another nurse. Answer. C. Report the observation to the nurse manager. Question 8. Which client should the nurse assess first? A. A post-op client requesting pain medication. B. A client with a blood glucose of 65 milligrams per deciliter and dizziness. C. A client waiting to be discharged. D. A client with an 4 antibiotic due in 15 minutes. Answer. B. A client with a blood glucose of 65 milligrams per deciliter and dizziness. Question 9. What is the safest practice when applying restraints? A. Tie the restraint to the side rail. B. Use a quick release not to secure to the bed frame. C. Leave the restraint on throughout the shift. D. Delegate monitoring to a UAP without instruction. Answer. B. Use a quick release not to secure to the bed frame. Question 10. Which task is appropriate to delegate to a UAP? A. Documenting intake and output on a newly admitted patient. B. Feeding a client with difficulty swallowing. C. Assisting a stable client to the bathroom. D. Teaching how to use an incentive spirometer. Answer. C. Assisting a stable client to the bathroom. Question 11. Which action ensures safe medication administration for a patient with dysphagia? A. Crush all pills together and mix with food. B. Administer medications with minimal fluid. C. Consult pharmacy for liquid alternatives. D. Ask the patient to self-administer. Answer. C. Consult pharmacy for liquid alternatives. Question 12. A nurse suspects a medication error occurred. What is the first action? A. Report the error to the nurse manager. B. Notify the healthcare provider. C. Assess the patient for adverse effects. D. Document the error in the medical record. Answer. C. Assess the patient for adverse effects. Question 13. Which of the following best prevents falls in a confused patient? A. Raise all 4 side rails. B. Place the call light within reach and frequently reorient. C. Use bed alarms only at night. D. Keep lights off to avoid overstimulation. Answer. B. Place the call light within reach and frequently reorient. Question 14. What is the nurse's best action when a patient refuses a prescribed treatment? A. Insist the treatment is required. B. Document refusal and do nothing. C. Explain the risks of refusal and notify the provider. D. Ask a family member to convince the patient. Answer. C. Explain the risks of refusal and notify the provider. Question 15. What is the nurse's priority during a patient seizure? A. Insert a tongue blade. B. Restrain the patient. C. Turn the patient to the side and protect the head. D. Place the patient in high Fowler's position. Answer. C. Turn the patient to the side and protect the head. Question 16. Which action promotes medication safety during handoff? A. Providing a summary and encouraging questions. B. Handing over a printed medication list only. C. Giving a brief verbal report without interruptions. D. Relying solely on EHR documentation. Answer. A. Providing a summary and encouraging questions. Question 17. A nurse finds a patient with decreased consciousness and slow respirations after pain medication. What is the priority action? A. Document the findings. B. Stimulate the patient and check the airway. C. Wait for the medication to wear off. D. Increase the next medication dose. Answer. B. Stimulate the patient and check the airway. Question 18. What instruction is most important when teaching a patient about using oxygen at home? A. Keep your oxygen tank on a wooden stand. B. Store oxygen away from heat and open flames. C. Turn the oxygen off only when sleeping. D. Change tubing daily. Answer. B. Store oxygen away from heat and open flames. Question 19. Which behavior by a float nurse requires immediate correction? A. Asking for help when unfamiliar with a task. B. Checking patient identifiers before medication administration. C. Leaving the medication cart unlocked. D. Asking questions about facility policies. Answer. C. Leaving the medication cart unlocked. Question 20. When reviewing MAR, the nurse finds a medication scheduled for 8 a.m. was not given. What is the priority action? A. Give the dose immediately without assessing. B. Document it was missed and move on. C. Check the patient's current condition and notify the provider. D. Wait until the next scheduled dose. Answer. C. Check the patient's current condition and notify the provider. Question 21. A post-op patient reports chest pain and shortness of breath. What is the nurse's immediate action? A. Administer prescribed pain medication. B. Notify the healthcare provider immediately. C. Reassure the patient and monitor. D. Assist the patient to ambulate. Answer. B. Notify the healthcare provider immediately. Question 22. A nurse notices a frayed electrical cord on an 4 pump. What is the safest action? A. Tape the cord and continue using the pump. B. Inform the next shift. C. Unplug the pump and tag it for repair. D. Continue use until a replacement arrives. Answer. C. Unplug the pump and tag it for repair. Question 23. A nurse assigns a UAP to ambulate a post-op patient. What instruction is essential? A. Encourage independence. B. Assist only if the patient asks. C. Monitor for signs of dizziness or fatigue. D. Let me know when it's done. Answer: C. Monitor for signs of dizziness or fatigue. Question 24. A patient is found lying on the floor after attempting to walk unassisted. What is the nurse's first action? A. Document the fall. B. Call for help and assess for injury. C. Notify the family. D. Report to the risk management team. Answer: B. Call for help and assess for injury. Question 25. Which medication error must be reported immediately? A. Giving a medication 10 minutes late. B. Administering a double dose of a high-alert medication. C. Holding a diuretic for low blood pressure. D. Giving an antibiotic 30 minutes early. Answer: B. Administering a double dose of a high-alert medication. Question 26. A nurse floats to a pediatric unit and is unfamiliar with care procedures. What should the nurse do? A. Perform all tasks independently. B. Refuse all patient assignments. C. Request orientation and assistance as needed. D. Ask another nurse to complete unfamiliar tasks. Answer: C. Request orientation and assistance as needed. Question 27. Which task is most appropriate to delegate to a UAP? A. Suctioning a tracheostomy. B. Monitoring for bleeding post-op. C. Assisting with morning hygiene. D. Inserting a Foley catheter. Answer: C. Assisting with morning hygiene. Question 28. Which client would the nurse see first? A. A client with chronic back pain requesting repositioning. B. A diabetic patient with blood glucose of 45 milligrams per deciliter. C. A post-op client asking for ice chips. D. A patient waiting for discharge instructions. Answer: B. A diabetic patient with blood glucose of 45 milligrams per deciliter. Question 29. A patient begins choking in the cafeteria. What is the nurse's priority? A. Call the code team. B. Start CPR. C. Perform abdominal thrusts. D. Offer the patient water. Answer: C. Perform abdominal thrusts. Question 30. Which action by the nurse promotes medication safety during administration? A. Administering meds without questioning the order. B. Asking the charge nurse to verify each dose. C. Confirming the patient's name and date of birth. D. Delegating medication administration to a UAP. Answer: C. Confirming the patient's name and date of birth. Question 31. A client on a PCA pump is difficult to arouse. What is the nurse's priority? A. Notify the provider immediately. B. Decrease the PCA dose. C. Attempt to awaken the patient every 15 minutes. D. Administer naloxone per standing order. Answer: D. Administer naloxone per standing order. Question 32. A nurse finds an unlabeled syringe in a medication room. What is the correct action? A. Assume it's saline and discard. B. Use it if urgently needed. C. Label it and place it back. D. Discard it according to policy. Answer: D. Discard it according to policy. Question 33. A nurse hears a loud crash in a patient's room. What is the best immediate action? A. Wait for the call bell. B. Call security. C. Enter the room and assess the patient. D. Notify the physician before entering. Answer: C. Enter the room and assess the patient. Question 34. A patient on anticoagulants reports new abdominal pain and bruising. What is the nurse's next action? A. Reassure the patient. B. Document and notify the physician. C. Offer a heating pad. D. Hold the next anticoagulant dose. Answer: B. Document and notify the physician. Question 35. What is the best method to confirm feeding tube placement before initiating feeding? A. Auscultate over the stomach. B. Aspirate and check pH. C. Ask the patient if they feel the tube. D. Flush with air. Answer: B. Aspirate and check pH. Question 36. Which action violates sterile technique during a central line dressing change? A. Donning sterile gloves. B. Turning the patient's head. C. Touching the sterile field with bare hands. D. Using chlorhexidine for skin prep. Answer: C. Touching the sterile field with bare hands. Question 37. A nurse is preparing to insert an indwelling catheter. Which action promotes safety? A. Using sterile gloves only when inserting. B. Cleansing the meatus after insertion. C. Inserting the catheter without lubrication. D. Maintaining a sterile field throughout. Answer: D. Maintaining a sterile field throughout. Question 38. A nurse makes a med error, but the patient is unharmed. What is the next step? A. Report the incident according to policy. B. Do nothing since the patient is fine. C. Change the documentation to cover the error. D. Tell the family only. Answer: A. Report the incident according to policy. Question 39. A nurse is giving discharge instructions to a hearing-impaired patient. What method is best? A. Speak loudly into the patient's ear. B. Provide written instructions and verify understanding. C. Ask a family member to explain later. D. Use medical terminology only. Answer: B. Provide written instructions and verify understanding. Question 40. A nurse is caring for a client with MRSA. What PPE is required? A. Gloves only. B. Gown and gloves. C. Mask and gown. D. Face shield and gown. Answer: B. Gown and gloves. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.